Hello everyone. In today's video discussion, we're going to be talking about an article that I find truly interesting. It's called Perforating Fat Injection for Chronic Plantar Fasciitis, a randomized crossover clinical trial. Plantar fasciitis is the most common cause of heel pain and accounts for approximately 10 to 15% of all medical foot consultations. Unfortunately, a percentage of these patients will progress to a chronic form of this condition called plantar fasciosis. It obviously represents a major medical and overall healthcare burden. Current surgical therapies such as a fasciotomy have several potential complications, and at the same time having consistent rates of satisfaction amongst patients. On the other hand, fat grafting. Its use has increased exponentially in the last decade. Several miraculous properties have been adjudicated to fat grafting, but not always followed by solid studies that have backed up the use of the fat in these cases. When I originally was asked to review this article, I do have to admit I was slightly skeptical, because it really was looking outside the box. But after reading it several times, I realized the potential of fat grafting in this specific condition. It's not something new for plastic surgery. We have pioneered several innovations within medicine, and these innovations have transcended the boundaries of our specialty. The use of fat grafting in this setting is not an area that's received yet much scientific study, and the authors are among the first to look into the immense potential fat grafting has. What the authors hypothesize is that by performing percutaneous incisions and fat grafting, this will decrease the thickness of the plantar fascia, and with that decrease pain and improve quality of life. What the authors did was basically a prospective randomized crossover pilot study. Patients with plantar fasciitis were basically divided into groups. One was the intervention group that received fat grafting, and the other was a group that received the standard of care, which basically is the use of nice splints and arch supports. Both groups were followed over time and measured the results. The procedure itself was done basically under local anesthesia using a 2-methylene solution, which was injected into the donor site. Fat was harvested by hand, and it was processed using a technique called the Coleman technique. And then the fat was basically injected using a blunt tip cannula, and it was injected in the plantar fascia on withdrawal in what we call a grid fascia. And this was done until no resistance was noticed. What the authors noticed as the results was basically that the pain in an intervention group improved significantly when compared to the control group. The control group itself had no significant change in function or pain between any time points. At the same time, activities of daily living and support-related outcomes improved significantly in the intervention group. Plantar fascia thickness was also noticed to have decreased in the intervention group. At the same time, the authors noticed there were no adverse events or complications in either groups. These results are very promising. Even though the study is slightly underpowered, and the fact that only a histological examination of the plantar fascia will prove regeneration, I think the study really represents a logic and very sound initial building block in the area of an alternative surgical therapy for managing plantar fasciitis. Thank you very much.